Welcome everyone. It's the Texas Values radio show on this beautiful summer day. We're happy you're joining us today. I'm Jonathan Covey. I'm the policy director for Texas Values, filling in for Jonathan Sines this week on the Texas Values Report. And you're in for a treat today because, and every show with us, of course, is a treat, but today we bring you back a good friend of the Texas Values Report to talk about some cutting edge news. I think you're going to find it very special. But before we do that, real quick, just as a reminder, you can catch us every week on this station, KTXW 1120 The Bridge, or you can watch us on demand on iHeartRadio, YouTube, Facebook, Spotify, all the live streaming platforms. Also, if you want to find out more about anything that we've talked about, go to txvalues.org. And you can also get breaking news and information by texting 797979, texting TX Values to 797979. Many of you watched our interview back in February with Dr. Eithan Haim, the whistleblower who exposed the medically dubious gender transitioning procedures that were going on under the radar at Texas Children's Hospital. Well, developments have taken place in Dr. Haim's story, and here to talk about it with us today is another doctor, a good friend of the show and himself no stranger to this issue, Dr. Tom Oliverson, representing Northwest Harris County, the Cypress-Tomball area in the Texas House, and of course, chair of the House Committee on Insurance in the Texas Legislature. Mr. Chairman, welcome to the show.
Glad to be with you, Jonathan. Thanks for having me.
Absolutely. So I know your time with us is somewhat short. We want to get right to the point here. Obviously, there have been some developments in Dr. Haim's story. So for our listeners who aren't familiar, can you give us just a little bit of background on how we got here?
Yeah, so Dr. Haim was a surgery resident. He was working at Texas Children's Hospital in his training programs, as all of us do when we're getting started. And he became aware of the fact that they were performing gender mutilating surgeries on children at Texas Children's Hospital. And so they apparently stopped, or said that they stopped, but then they didn't really stop. And so he decided to provide evidence of the fact that this was still occurring. Of course, this was all carefully redacted, containing no patient identifying information or what we would consider to be a violation of federal law under HIPAA, and leak that to the media. And, it's very embarrassing. So the hospital then shut the program down. It was interesting to me that as this was all playing out, you and I were working along with, 1,000 of our closest friends to, legislatively end the practice of mutilating children in Texas with surgeries and medications. And I personally had no idea this was even happening. I remember meeting him over the summer at a TPPF conference, and I was just blown away that this was all going on behind the scenes while we were working legislatively to put a stop to this. So the issue before us, I think, concerns the fact that he blew the whistle on this hospital prior to our law passing, because now that the law is in effect, none of this would be permitted under state law. And in fact, if someone anonymously complained to the medical board about a hospital or a surgeon doing what he saw them doing back then, those doctors would have their licenses stripped from them.
Right. So, and of course, now we have the Department of Justice that's seems like they're coming after him as well. What's going on there? What are they after him for?
Yeah, I mean, I think they're going after him for basically alleging, misconduct and all of the. I'm not exactly sure what the exact particulars are, but I believe what they're going after him for is the fact that he provided this information, right. And they're alleging that he's violated the law by doing so, and so they're literally throwing the book at him, much like President Trump has experienced. For very ticky-tack things, not even clear that he actually did do anything wrong, especially if the information was carefully redacted. But he's getting the book thrown at him, not because of the criminal justice implications, but because of the political implications. Right. And I mean, what would you expect from the Biden DOJ? I mean, yet another example that they just simply can't follow the law. They have to weaponize everything politically. I think it was one of our incoming colleagues, Mitch Little, who I heard first use the term lawfare.
Yeah.
And yet here we have another example of that.
It is, and from what I've seen, obviously, whistleblower testimony was crucial in sort of blowing the lid off of gender transition scandals in the UK. It was doctors
Mm-hmm.
out there and clinicians out there that at Britain's main gender transition clinic that alerted journalists to the fact of things that were going on, and then that in turn led to the Cass report, which brought about major reform over in the UK on gender
Mm-hmm.
policies. Why does there seem to be sort of a double standard here in the U.S. on that?
Well, because the doctors in the US, quite frankly, are not following the science, Jonathan.
Yeah.
I mean, the reality is that everywhere else
Recording in
seems to
progress.
be honestly doing their due diligence, following the science. The Cass report. I mean, England had engaged in gender modification of kids for a lot longer than we had, and had done it in a a centralized, socialized medicine health planning service route. So it was the government all enmeshed in it as well.
Right.
And they, followed the science. They looked at the studies, they looked at the research, they did some of their own studies, and they realized not only does this not help children resolve gender dysphoria issues, it actually harms them. I don't know if you saw, but recently there was a study that came out that said that male to female transitioners that undergo gender quote conforming surgeries are more likely to attempt suicide than those that don't.
Right.
I mean, that's literally exactly the opposite of what they were telling us last year, if you recall, as we were working together to get this bill passed. They were saying, oh, no, no, you're going to take away this life-saving treatment from these folks. That's not saving any lives. It
Right.
may actually be taking lives.
Right. Yeah. I mean, and as doctors, you're under an oath to do no harm, and of course, in Dr. Haim's case as well, he's finishing up his residency and graduating. I mean, what kind of how could he sort of operate with how could he not do this? I guess is the question. He absolutely was under a duty, I would think.
I think a man of good moral conscience and character, who I think is exactly the kind of person that we want in healthcare, is obligated to say something, obligated. And quite frankly, I would, if I were him, and I know he probably does, but I would wear it as a badge of honor that you were willing to speak truth to power. As you know, I'm experiencing that a little bit myself right now, but that takes a tremendous amount of courage. And you can't do that without thinking that you're going to face no consequences. So I'm very proud of what he's done. I've certainly been very supportive. He actually has a GoFundMe of sorts, because he's going to have a lot of legal bills to pay for this, because he's now going to have to hire attorneys, just like President Trump has had to do, to basically defend his reputation against malicious and unjust persecution.
Right, exactly, and I guess that's sort of the point, right? The process is the punishment, in a sense,
Mm-hmm.
because they drag you through court. It could be years before
Mm-hmm.
this is resolved, and hundreds of thousands of dollars in legal fees. So we're going to continually be supporting Dr. Haim, and our prayers are with him, of course, as well. Um, do you have any experience in understanding sort of what the specific charges of, like, violating the Hippocratic, or violating HIPAA, in a sense, what type of penalties he's facing? Of course, understanding the fact that, for our listeners especially, that an indictment is not the same as a conviction, right?
That's right.
It's a prosecution basically coming before a grand jury and saying, okay, here's the evidence I have, that I believe there might be something here to look at, and the grand jury either agreeing or disagreeing. So, any thoughts on that, of what sort of he might be facing from the DOJ if they move forward?
Yeah, Jonathan, that's a little bit out of my wheelhouse, because
Yeah.
I'm not a lawyer. But what I can tell you in my own experience as a doctor is that the feds do take HIPAA very seriously, and there are fines there's permanent loss of licensure or ability to participate in the Medicare or Medicaid program, which basically prevents you from really being able to contract with anybody for to provide any medical care. Because if you can't get your number and credentialed through CMS, then a lot of the insurance companies won't work with you either. I mean, so it really is sort of a scarlet letter, if you will, from the standpoint of, government can really ruin your life in this way. I don't know if there's jail time involved. I don't remember. But I know that there are significant fines
Yeah. I
and
think it might be
penalties
even
for
like
violating it.
maybe 1 year in jail, or up to 5 years
Yeah,
in some cases. So, and of course, multiple
it's
charges.
it definitely wouldn't surprise me. But again, I think the other point of all of this that's really important, and the reason that we need to stand with this doctor and fight with him on this, is that they're not just doing this to attack him,
Right.
but the collateral damage is that any whistleblower that might potentially come forward to register a complaint against SB 14 is now looking at the fact that we have a weaponized federal Department of Justice that's actively seeking out and attacking people that do report. And remember that the SB 14 mechanism of action is that it requires anonymous complaints to be reported to the medical board, and that's how action is taken. So
That's right.
so they're having a chilling effect on our ability to enforce state law by doing this.
I was about to
And I'm
say
sure that's intent. That's
that
the intent.
that's the chilling effect. Yep, that's right. We're talking with Dr. Tom Oliverson, representing Texas House District 130 in Harris County. As we're coming to the end of our fiscal year, guys, on June 30th, we have a number of crucial fights that are coming up. So just want to say, if you can make a donation, help us stay in the fight. We would very much appreciate that. If you find value in the work that we do, go to txvalues.org and drop a donation. It helps keep bad books out of public school libraries, helps us push back against the Biden administration, women's sports issues, all sorts of things. So I know you have to go soon, Dr. Oliverson. I want to talk about one quick thing before we wrap up, and that is a decision that came out at the U.S. Supreme Court just this morning. You may have seen this. The U.S. Supreme Court put out its decision today in FDA versus Alliance of Hippocratic Medicine. That's the group of doctors, the anti-abortion doctors who had questioned the FDA on their decisions making the pill access easier. And basically, the Supreme Court, said that they don't have legal standing to sue. Standing meaning basically you don't have a dog in this fight. So they threw the case on procedural grounds. And one of the arguments that the doctors had advanced for trying to show standing was that the FDA's actions were causing conscience injuries to doctors because, when complications arise, obviously women go to the hospital, they have to perform an emergency abortion, and then it causes, conscience injuries to doctors. So, thoughts on that and thoughts on here in Texas, what we need to do to get conscience protections passed here.
Well, as you know, because you have helped me session after session, I continue to file legislation that would expand greatly and forever protect and enshrine a healthcare's right of conscience to be able to not engage in conscience violating healthcare procedures or treatments. And so I do think that's important for the reasons that I stated earlier, which is that I think we want moral and ethical people encouraged to practice medicine or nursing or healthcare in general. Because they tend to actually put the needs of the patient ahead of their own needs,
Right.
which is exactly what I think you're looking for in a healthcare provider. I will just say this of the FDA. The FDA, in my opinion, is a terrible organization. Their only real success as an organization, it goes all the way back to the 1960s with the prevention of a medicine called thalidomide from being introduced to the market because it caused severe birth defects. Aside from that, I see them as being one of these government bureaucracy, sort of oligarchy type, probably special interests are what really drives the train there.
Right.
They're very fast and responsive in approving things when they think it's going to benefit the administration, and they're not so good at doing things that maybe don't make as much money for people, but would actually help patients. So And with that, I do have to run, my friend. I appreciate your time.
Dr. Oliverson, thank you so much for taking time on the show. We'll look forward to hopefully talking to you again soon, but thank you for
Yes,
joining
sir.
us.
Yes, sir. Thank you. I appreciate you.
Thank you so much. We do appreciate Dr. Oliverson's time, and it's such an appropriate, and relevant time to be discussing all of this, especially since we're seeing this, being discussed on a national scale as well. There were reports last month. And I mentioned this on a show recently with Mary Margaret Olahan, but there were reports last month that WPATH, the World Professional Association of Transgender Health, which is basically a front organization for LGBT advocacy groups, they commissioned a study by experts from Johns Hopkins University to perform systematic reviews on what they called the evidence for transgender or gender-affirming care. After the results of these studies were put together, however, they attempted to restrict the ability of researchers to publish the findings because of the total lack of evidence that this was good for children and good for adolescents. So the gaslighting here that's going on is almost breathtaking. But thankfully, because of Dr. Haim and others like him, the stories are coming out. We're finally starting to see the evidence of all the double standards, in the press, with the legal elite who they would praise whistleblowers, but not when their favorite liberal issues are involved and are exposed. So we're grateful for Dr. Oliverson and his insight. It's interesting with this morning's decision from the U.S. Supreme Court, and we talked about this earlier, because the court actually said no, these doctors can't show that they would be forced to perform more emergency abortions because of the FDA's directive. And they said that because we have a federal law that protects doctors and healthcare personnel if they refuse. That federal law is called the Church Amendments. And it actually has protected doctors on a federal level since mifepristone was first approved by the FDA back in the year 2000. But in Texas, we don't currently have expansive or comprehensive conscience protections for doctors, for physicians, for healthcare personnel. And so that is one thing that Texas Values will be working on this session as well. So we're excited to sort of see the national narrative coming around on this issue. And we are coming around to the end of our show, but I want to remind you guys of a few things. So first of all, don't forget our 7th annual Texas Faith, Family, and Freedom Forum. That is September 13th through 14th of this year. We're going to be doing this at Great Hills Baptist Church, where we've done it before here in Austin, Texas. And we have a number of really great speakers. There are a bunch of speakers, including Dr. Tom Oliverson, who we just spoke to. Of course, we will be having Dr. Eithan Haim, this whistleblower on child gender modification. We'll also be having Senator Bob Hall, Melissa Oden, Mary Margaret Olahan, whom we had an interview with not too long ago. I've also got a list of a few other folks. Commissioner Sid Miller, Macy Petty, the athlete, Bill Bach III from the NCAA, Jana Long, Walter Wendler, Mandy Drogan, Connor Champion, Christian Collins, Andrew Yeager as well. And so we have a number of really great speakers. We've got some more speakers in the queue that we'll be announcing shortly as well. But guys, we want to thank you all. You've been faithful listeners and supporters. And just say that if you find value in the work that we're doing at Texas Values, we could use your donation. We're coming up on the end of our fiscal year. We're coming up to the end of June. And we're trying to get in the last little bit so that we can continue operating for faith, family, and freedom. And as always, if you want more information about the work that we're doing, we would ask that you visit txvalues.org so that we can continue to employ high-quality folks in the work that we do on your behalf. And as we've said so many times on this podcast, government belongs to those who show up. And here at Texas Values, we are dedicated to being your boots on the ground for social conservative issues. This is Jonathan Covey. I'm glad you joined us, and I'm inviting you here back next time as we continue to lay down a vision for the next conservative generation. Thanks for joining us.